Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to my channel. This is Dr. Sana. Let's start today's topic. Today's topic is urinary leakage or urinary incontinence occurs in men. So, what is urinary incontinence or urinary leakage? So, urinary incontinence or urinary leakage means loss of bladder control and causing urine to leak unintentionally. Okay, it is more common. Many men don't admit this problem or don't acknowledge this problem, especially when they get older, and it can have several causes. So, urinary leakage is not a normal condition, or leaking of urine unintentionally is not a normal condition. You may have some underlying problems related to that, so seek attention as soon as possible and talk with your provider, the medical provider, about your issue. Let's look into the types of urinary incontinence. The types of urinary incontinence: stress incontinence, urge incontinence, overflow incontinence, functional incontinence. So, the stress incontinence, let's look into the details of each type. In stress incontinence, the leakage happens when pressure is placed on the bladder. That is when coughing, sneezing, laughing, lifting some heavy objects, physical activity, etc. Often happens in males after prostatic surgery or weak pelvic muscles. Urge incontinence or overactive, that's also called as overactive bladder. How it is presented as you may feel sudden urge to urinate and inability to hold the urine. Okay. Sudden uncontrollable urge occurs and frequent urination, leakage of urine before you reach the restroom, may wake up frequently at night to urinate. Okay. Next type is overflow incontinence. In overflow incontinence, bladder does not empty properly, causing constant dribbling. In this, urinary system is weak, feeling bladder is not fully empty, frequent and small leaks. This condition commonly linked to enlarged prostate glands. Next, we look into the functional incontinence. So, in functional incontinence, bladder is normal, but the physical or mental issues prevent reaching the restroom in time. Okay. Now, let's come to the common causes in men causing these leakage of urine. One is prostatic problems. Enlarged prostate, as I said before, enlarged prostatic conditions, sometimes overflow incontinence can occur. And it is very common after the age of 50. Another causes related to prostatic problem is prostate surgery, prostate infections, etc. Now let's look into next cause. It is nerve or brain conditions. For example, diabetes, stroke, Parkinson's disease, spinal cord injuries, etc. also results in these kind of problems like leaking of urine. Next cause is muscle weakness. Weak pelvic floor muscles, aging related muscle weakness also causes leaking of urine. Next cause is medications or lifestyle factors. Sometimes using of diuretic pills also cause leaking of urine. Alcohol, excessive caffeine, obesity, smoking, etc. also causes this problem, the leaking of urine. So, let's look into the symptoms, how it may appear. Urine leaking during activity, sudden urge to urinate, frequent urination, difficulty in controlling urine, nighttime urination, and weak urine flow. Okay. Now let's come to when you need a medical attention. You should seek a medical attention if leakage happens repeatedly. Pain or burning sensation is there during urination. Blood in urine, sudden loss of bladder control, difficulties in starting urination, and leakage affecting your daily life or sleep. Now, how does doctors evaluate these problems? They may check medical history, urine test, prostate examination, bladder function test, or ultrasound imaging if needed. Now let's come to the treatment options of this condition. Treatment usually depends on what is the cause. Now let's look into the different options in treatments. Lifestyle changes, reduce caffeine intake and alcohol intake, maintain healthy weight, uh, timed restroom visits. Next option is pelvic floor exercises. It strengthens, it is very effective in strengthening the bladder control muscles. Now comes to next option, medications. Medications are used for overactive bladder or prostate enlargements. Now, our next option is medical procedures or surgery. Sometimes, in severe cases, procedures like surgeries are needed. Okay. So, the key point you should remember is urinary leakage is not a normal part of aging and is usually treatable. That's the point I want to remind you today. Let's wrap today's session over here. Thanks for watching. Assalamu alaikum wa rahmatullahi wa barakatuh.